Thank you for all your kind words. I'd just like to make a comment about the First Link program. So this is a national program launched by the National Alzheimer Society and now coming to Newfoundland and Labrador through the efforts of Shirley and the rest of the staff here in our local Alzheimer Society. It's very much in keeping with the mandate of the Alzheimer's Society, both nationally and internationally, in terms of the Society's interest, first of all, in enhancing public awareness about these diseases, also in terms of providing support and education for families and for patients who are living with problems, and also promoting research, because that's where things have to go in the future in terms of finding treatments and potentially cures for these devastating kinds of disorders. So to continue on then, we'll get started with the body of the session today. Before I start, I'd like to invite everyone to make comments or add their own subjective experience or questions that you might have as we go. I don't mind if you interrupt me. I'd rather deal with any questions that you have right at the time that we're going through it, although we'll have time at the end as well if you have further questions then. Okay, so this will be, I think we've already dealt with the research part, right?
Yeah.
Okay, so we can go on to the next slide. Yeah, so this is more or less an outline of what we're going to discuss today. Each bullet point will go into a little bit more detail as we go. So what is dementia? This is a common question that I often hear from people who are trying to understand more about the nature of these conditions. And so we have to keep in mind that the word dementia really refers to a syndrome, and I can probably best explain that by relating it to other kinds of medical syndromes that you may have heard about. So if I said somebody has kidney failure, the syndrome is the symptoms that the person would have with the kidney failure, but the disease that causes the syndrome is something else altogether. So you could have kidney failure because you have diabetes, you could have kidney failure because you have tuberculosis in your kidneys. I mean, there's a multitude of different reasons why you might have kidney failure. So dementia is like that. It's a syndrome, a cluster of symptoms that occur, and then there are other specific reasons why these symptoms may occur. So these are the prominent symptoms that we see in dementia. There is often a loss of memory that is noticeable, and that loss of memory often involves more the short-term type of memory function, at least early on in the illness. It also impacts on communication, and communication, mostly in the form that we human beings communicate, has to do with language. And therefore, the way that these diseases affect language will have some bearing on the person's ability to communicate. The problems with language can have to do with things that you may recognize in your family members, and they could be trouble finding words, not being able to think of the right word for the circumstance. There may also be difficulty expressing sort of more abstract concepts or thoughts. And then there's the problem of understanding, which is the receptive part of language. So the difficulties with communication affect both the person's ability to express themselves, but also the ability to understand what's being said to them. And you may see that as an early symptom. And then lastly, there can be some changes in the person's judgment. And a multitude of these can occur. They will translate themselves into changes in behavior or changes in personality, so that the person may be doing or saying things that you as a family member will know are kind of out of character for that person. And these could be early changes that would signal the onset of a condition like this. Another common aspect of that is the loss of insight. So as a person moves through the duration of this illness, there may be some understanding, particularly at the early stages, that there's actually a problem. My memory is failing, or I can't get my words out. But that insight often gets lost as time goes on, and that will affect the person's judgment then in terms of their ability to actually recognize the problems that they're actually having. And there can be other ways that loss of judgment will express itself in the course of the illness. Okay, so again, this kind of puts it into a picture form to understand that the word dementia is an umbrella term, whereas underneath that umbrella there are these other various kinds of dementia that a person can have that would fall under the general heading of dementia. In terms of terminology, again, you can move on. So, as we've said, dementia is not a disease in itself. It's a syndrome, refers to any number of different pathologies. Alzheimer's disease is one of these pathologies that would be underlying dementia. And Alzheimer's disease is also the commonest kind of dementia. The other ones may include things like frontotemporal dementia, also known as Pick's disease, Lewy body dementia, vascular dementia, or mixed dementias in which more than one factor may be causing a problem. And then there's the issue of memory loss. Now, some memory loss is a natural feature of aging, and it's important to try to distinguish what's actually normal memory loss and what's pathological memory loss. So as we get into our 50s and 60s, we all become aware that memory may fail a little bit. It's maybe not quite as sharp as it was. And that would be deemed to be a natural occurrence, just like your joints get kind of stiff and maybe your exercise tolerance gets a little bit lower, so does your brain, you know, and so therefore the threshold for forgetting a little more may have been impacted. The critical difference between the memory loss that occurs as a result of normal aging and the memory loss that occurs in a disease is the degree to which there is actually a functional impairment associated with it. So if we're a little bit forgetful in our 50s and our 60s, well, you know, we may forget a message on the phone, something that's not too important. That's not necessarily a disease. It's when those impairments are actually encroaching into your everyday life that it becomes a problem. And memory loss can be caused by any number of things, including an injury to your brain, you know, a head injury or an accident, including the consequence of a disease, like an infection. It can be caused by emotional trauma. Frequently, I'm sure we've all experienced what happens, for instance, when there's a death in the family, and how that emotional status that the person may be in immediately in that situation may translate into some loss of concentration or loss of the ability to keep track of everything that's going on. But that passes off over time, so that's the kind of emotional trauma that might affect you a little bit in your memory, but would not be a permanent condition or a disastrous sort of pathological condition. Okay, so these are some of the things that are reversible in terms of memory disorder. So depression is highlighted here, but really all the different psychiatric disorders that occur can have some bearing on memory function. So that might include conditions like anxiety, sometimes even conditions like psychosis, will have some interplay with the person's ability to concentrate and therefore their ability to remember. Depression is often a prodrome or a condition that you may see in a person before the symptoms of, say, Alzheimer's disease really become manifest. So in that first year or two, you may notice that the person seems less interested, they have less initiative, they're not as bubbly as they perhaps used to be. And you may think that that person is depressed, and sometimes they are, and sometimes they will benefit from treatment for depression. But the long-term studies that have looked at that have noted that you can treat that depression and the person will be better for a period of time. But if there's actually dementia underlying it, that dementia will continue to progress and will become more manifest over time. Other culprits in causing changes in cognition include medications. And there's a raft of these, but I will summarize by saying that the greatest offenders are the sedative drugs and the narcotic drugs, because these have fairly pronounced cognitive effects. And then there's a whole group of other drugs that can be, this is getting into a little bit of medicalese kind of talk, but they're called anticholinergic effects. And many drugs have anticholinergic effects. They may include things like some of the older antidepressant drugs. They may include even some drugs that might be cardiac drugs, blood pressure drugs, drugs for steroid type drugs. All of these drugs may have a little bit of what's called an anticholinergic pharmacological property, and therefore can be implicated in some changes that you may see in a person's memory function. Nutritional disorders, particularly the B vitamin group, is the one that we see most often these days. Certainly malnutrition or very severe nutritional deficits can occur, but in this society we don't tend to see that so much. But we do see lots of people with B vitamin deficiencies, particularly B12, because of the association between the way that we absorb the B12 vitamin through our stomach and the fact that as we get older there is less ability for the stomach to actually carry the B12 vitamin into the circulation. And so your diet may be okay, but you can still develop a B12 deficiency just because you can't really absorb it very well. And B12 is one of the vitamins that's very much associated with normal functioning in the nervous system, so it's very important to look at that one. There are a number of other conditions that can cause reversible changes in cognition, and some of these would include metabolic disorders like too high a level of calcium in your bloodstream, or thyroid dysfunction is another one that needs to be ruled out, and treated if it's there. Another one is excessive alcohol. Alcohol is definitely a problem. It's much like the sedatives and the narcotics in terms of its overall effect on the brain and the function of the brain. However, I should put a little caveat on that because we also know that a small amount of alcohol, and we'll get to that later when we talk about vascular diseases, but we know that a small amount of alcohol is actually beneficial and recommended. So the problem is when the alcohol is excessive. That's where the issue lies there. And lastly, sorry, it's okay. There's a condition called delirium. You may have heard of that. Lots of people develop delirium when they go into hospital with a critical medical illness. Say they have an overwhelming infection, or they've had a heart attack, and they've been they've been severely affected by that. So there's this state of confusion that can develop in hospital fairly acutely, which is called a delirium. And that's usually due to the combination of a number of severe pathologies affecting that particular patient. And if all goes well and there is no problem preceding the delirium in terms of the person's cognitive ability, most of the time the person will come back to normal once that period of overwhelming illness has been dealt with. So delirium is important to know about because that is a reversible condition.